Hypertension affects between one-third and one-fourth of humans. Uncontrolled hypertension shortens life expectancy by 5 years because hypertension is a major cause of stroke, heart failure, renal failure, and coronary disease. And despite having several medications for treating hypertension, the majority of hypertensive patients have uncontrolled blood pressure. But it seems we have a breakthrough treatment.
Welcome to Cardio Buzz, your one-stop shop for all things cardiology. We bring you the latest news on heart health. Whether you are a healthcare professional or just interested in heart health, we have something for you.
Hi doctor, do we still have a problem in treating blood pressure?
We have several medications and combinations to treat hypertension. Despite that, less than 1/4 of hypertensive patients are controlled.
Why is hypertension difficult to control?
Many hypertensives are unaware of their illness. Physicians may be reluctant to start treatment or to increase the dose. Many patients are not adherent to their daily dose of antihypertensive medication. Our medications have limitations in terms of strength, side effect, and after all, some hypertensive patients may be truly resistant to medication.
Can you elaborate more on the strength and side effect issues of medications?
Yes, let's take the renin-angiotensin system as an example. The system plays a key role in blood pressure control and in blood pressure elevation. Targeting the system with medications will lower the blood pressure. However, the residual risk remains high even on treatment. This could be due to the potency of these medications or their side effects. Long-term blockade of the renin-angiotensin system results in a compensatory reaction by the body with an increase in the release of renin. This is called the renin escape phenomenon, and this may limit the potency of renin-angiotensin system blockers. Also, these medications may have side effects like increase in serum potassium, which can be dangerous.
Do you mean we need better blood pressure medications?
Yes, we need medications that are effective, free of side effects, cover 24 hours, and they have long duration of action so that we can omit taking a pill every day.
And do we have that already?
Well, not yet, but it seems that we have a breakthrough treatment on the horizon, and these are RNA therapeutics.
What are the RNA or DNA therapeutics?
DNA resides inside the nucleus, and DNA has the code for synthesis of all proteins. But DNA must send this code outside the nucleus to the cell for the cell organelle to produce these proteins. And this messenger is called the messenger RNA. So if we want to stop the production of any protein, then we just shoot the messenger. Therefore, we abort the production of that protein for a long duration of time.
How does that apply to hypertension and to the renin system?
Angiotensinogen is a protein. It's mainly produced by the liver. If we stop the production of angiotensinogen in the liver, then the renin-angiotensin system will be silenced.
And how can we target that messenger RNA?
We target the messenger RNA by using a small interfering RNA.
And what is that small interfering RNA?
As the name implies, these are small or short sequence of nucleotides, and they bind to the specific messenger RNA, degrading the messenger RNA and preventing the protein synthesis.
Okay, do we already have them as drugs?
Yes, we have small interfering RNA as drugs to lower the cholesterol. We have Engl, which is a small interfering RNA, and 1 injection or 2 injections of Engl can lower the LDL up to 6 months.
Got it. And now we have them for hypertension.
Exactly, we have zilebesiran, which is the first in-class small interfering RNA. It silences the hepatic production of angiotensinogen, leading to suppression of angiotensin 1, 2, silencing of the renin-angiotensin system, and therefore blood pressure control. Circulating angiotensinogen is mostly derived from the liver, so the small interfering RNA needs to target the messenger RNA in the liver.
How does zilebesiran target the liver specifically?
To accomplish that, the small interfering RNA is conjugated to a molecule called GalNAc, and this GalNAc binds to a specific receptor on the surface of the hepatocyte. It's very specific to that receptor on the surface of the liver cells. And so, the small interfering RNA only targets the liver. It does not affect the angiotensinogen production in the kidneys, in the brain, or in the adipose tissue.
You mean it will not have any effects on the kidneys and other tissues?
Yes, most likely when we target only the liver cells, extrahepatic angiotensinogen production will be preserved, limiting the side effects on the kidneys and on other tissues.
Will we see compensatory escape and reactivation of the renin system as we saw with ACE inhibitors and other receptor blockers?
Angiotensinogen is the sole precursor of angiotensin 1 and angiotensin 2. Therefore, inhibition of the renin-angiotensin system with this approach will limit theoretically any compensatory reactivation or escape of the system that we see currently with ACE inhibitors or angiotensin blockers.
So was the drug tested on humans?
Yes, we have the result of phase 1 study, which is a study to find the proper dose to see the drug interactions and the side effects. The study was recently published in the New England Journal of Medicine. A group of researchers from the United States and the UK found that a single dose of zilebesiran reduced the production of angiotensinogen, suppressed the renin-angiotensin system, and resulting in long-lasting blood pressure lowering effect. The researchers included 107 patients with hypertension. They excluded secondary hypertension, diabetic patients, patients with postural hypotension, and patients with previous cardiovascular events. The study had more than one part. In the first part, patients were randomly assigned in a 2-to-1 ratio to receive either a placebo or an injection of different doses of zilebesiran ranging from 10 milligrams up to 800 milligrams. Patients were followed for 24 weeks, and the researchers found 21 millimeter mercury reduction in systolic blood pressure at 6 weeks after administration of the 800 milligrams, and the effects were sustained up to 24 weeks after a single dose. In another part of the study, they tested the effect of 800 milligrams when co-administered with irbesartan, which is an oral angiotensin receptor blocker, and this combination gave an extra lowering of the blood pressure.
Did I hear that correct? 24 weeks. Do you mean that a single injection reduced the blood pressure for a whole 6 months?
Yes, the effect was obvious after 6 weeks of just one injection, and the blood pressure lowering effect lasted up to 6 months.
Wow, that's impressive. So patients did not need to swallow a daily pill, just one shot and forget blood pressure for 6 months. But wouldn't that be dangerous if the patient becomes hypotensive for any reason? The drug effect will still be there, right?
Well, your concern is valid, but it's reassuring that there were no drug-related hypotension that required medical intervention during the study.
Okay, but all the patients in the study were low risk. Perhaps if we give it to higher risk and elderly patients, they might become hypotensive and that may last for 6 months. How about that?
Yes, you're right again. That's why the researchers in another part of the study assessed the effect of the 800 milligram dose under low salt and high salt intake. And they found that the blood pressure lowering effect of zilebesiran could be reversed through a high dietary salt intake.
That's good. So salt can antagonize the drug effect. But it would be more reassuring if we have an antidote or a reversal agent, isn't that correct?
Yes, of course, there is a platform for reversal. It's called Reversir. It's been developed for rapid and potent reversal of small interfering RNA. This platform also uses the molecule called GalNAc, so it's very specific to the liver. A single dose of Reversir can fully reverse the effect of the small interfering RNA within 4 days.
It is good to know that, but does that shot have other side effects?
In the study, there were no deaths, there were no unplanned hospitalizations, no significant change in serum potassium, serum sodium, kidney functions, and the only side effects were injection-related reactions.
ACE inhibitors and other renin antagonists are contraindicated in pregnancy. Can zilebesiran be used in pregnancy?
Preclinical studies that evaluated angiotensinogen small interfering RNA in rat models of preeclampsia didn't detect any deleterious effects on the pups. And the preclinical studies showed that small interfering RNA did not cross the placenta. But still, we are not sure. There are insufficient data to evaluate whether the known teratogenic effects of renin-angiotensin system inhibitors will be seen with zilebesiran or not. We need to wait.
So, I hope I got it correct. We have a single shot that can lower blood pressure for 6 months with very few side effects, and it does not cross the placenta.
Yes, we get 6 months of 24-hour blood pressure control with just one injection. The effect can be reversed by taking salt, and there is a specific antidote, and there are no effects on kidney functions, and it has the potential for use in pregnancy.
That sounds great. Do we have the injection available now for use?
The medication is not available yet. It still needs to be further evaluated on bigger trials. This trial is just on 100 patients, so it's planned to be studied in 2 coming trials, and we'll get you the results once they are ready.
Thank you for watching. We hope you enjoyed this episode of Cardio Buzz. If you did, give us a thumbs up and subscribe to the YouTube channel and to the podcast on Spotify, Google Podcasts, and on Apple Podcasts. And don't forget to check out our other episodes for more information on cardiovascular health. See you in the next episode.